So before we give any handouts or do anything with a low FODMAP diet, there are certain changes that you can make. Hello, my name is Erin Judge. I'm a registered dietitian and owner of Judge Nutrition and Wellness, which is a virtual nutrition counseling practice for women with IBS. So I help women with IBS manage their symptoms through a low FODMAP diet and other versions of a FODMAP diet and different lifestyle modifications that I'm going to share a little bit about with you today. If you don't know, IBS or irritable bowel syndrome is a functional gut-brain disorder, so it can affect the motility of the gut, making things either move a little bit faster or a little bit slower. And it can also impact the way that people perceive different things that are happening in their gut. So gas and bloating, things that might be, just kind of average and mild for most people. Those with IBS, there's this issue called hypersensitivity. So the gut perceives those different symptoms as being much worse and much more painful than they would be for the general population. So patients with IBS are really dealing with a lot of issues going to the bathroom and then a lot of pain and uncomfortable symptoms that are hard to explain and hard to understand unless you're stepping into their shoes and experiencing it yourself. IBS is pretty common, so it affects about 10% of the US population. It's about the last statistic that I've seen. Most people with IBS are women over men, so 3 out of 4 are women. There is a large case of these people in our country and in our world, and so it's really important to understand kind of what to look for whenever you have a patient with IBS, because IBS could be an overlapping condition with a different condition that you're working with them on. So a few different ways that we target IBS in terms of nutrition management. The low FODMAP diet is there, but it's actually not the first step. So the first thing that you want to do is make sure that you're screening for any eating disorders, any overlapping conditions, and making sure that you have an accurate diagnosis. So because IBS is symptom-based, it's diagnosed via the Rome criteria, there is a high chance of misdiagnosis and missing maybe certain conditions like IBD, celiac disease, different allergies, even bowel cancer and colon cancer. Those things might get missed and diagnosed as IBS if they're diagnosed by maybe the wrong professional or just in the wrong place and time. So it's good to make sure you've got a really clear diagnosis from a gastroenterologist and that those steps have been taken to rule out those other conditions. You also want to screen for an eating disorder because that's going to influence what you do moving forward. If you have a patient with an active eating disorder and IBS, you want to make sure that you are addressing the eating disorder first, because there's going to be a lot of food fears with IBS whenever you start digging into the symptoms. There's also going to be a lot of diet modifications that you might be making with a patient. So you want to make sure that you're not doing harm, because that's our number one goal, is to do no harm. So screen for the eating disorders and screen for even some of those disordered eating behaviors so that you can make sure that you're addressing those as you move forward and start talking about those different food fears and what's going on in their bodies and with their diet. So moving on to the diet. Before you jump into low FODMAP diet, which is kind of our traditional model. So what I see a lot with different patients, because I'm in a private practice setting, I see a lot of people come to me who have been just given a handout from their dietitian that they saw in the gut clinic or the digestive health clinic that they went to. And the problem with that is that, other modifications and changes weren't made. And so someone's going straight into a low FODMAP diet, and that might not even be necessary because the symptoms can vary widely between different people. And then they're given this handout, and the low FODMAP diet is extremely complex and very difficult, so it usually sets them up for failure. And so they're really frustrated. They feel even more at fault for their symptoms that they were already feeling before. So we want to be mindful of that. So before we give any handouts or do anything with the low FODMAP diet, there are certain changes that you can make. And I always say just start with the basics. Whenever we're talking about digestion, you know what to look for. So start there and then build into the elimination diet. A couple of things that you may want to look for is the high intake of high fat foods, lots of sugary foods, lots of processed foods. Those may not be being digested well and could be causing some issues with the gut. You can also look for other gut irritants, like a lot of alcohol, a lot of spicy foods, a lot of caffeine, especially coffee, that might make things move a little bit faster, leading to more diarrhea symptoms. So you can look for that. Other things like juicing and those types of modifications to our food and our diet that might make things change as they move through the gut. And then you can look for fiber intake. Are they eating enough fiber? Are they eating way too much fiber? Be on the lookout for that. You can look at how they're eating. So large meals, are they eating really quickly? Are they taking their time? Would it be better to do smaller meals more frequently versus large meals? And then also, are they restricting a lot? So over restriction can lead to some digestive issues. So we want to make sure that they're not restricting all day or doing like long periods of fasting that might be contributing to some of their symptoms. Another big component that I always want to hit on before getting into the low FODMAP diet is stress. Stress is going to affect the gut almost more than anything else. So make sure that you're checking in on how they're managing stress, what stressors are going on in their life, and what changes can be made in order to reduce that stress and that effect on the gut. So after you go through the basics, then you want to move into the low FODMAP diet. It is a 3-phase diet, so it includes elimination, challenge or reintroduction, and what we call individualization. So whenever we hand someone just a pamphlet, usually it leads them just to the elimination phase, which should only be about 2 to 6 weeks. If you're not seeing results in about 6 weeks, that means the diet's not appropriate. But that includes elimination of all high FODMAP foods. If you don't know what that is, and if you're not sure what resources to look for that phase, the Monash University website and app is a great resource. So that's a great they have a full food list of different FODMAPs and different foods. Every practitioner might do it a little bit differently, but that's where you begin. And then you move on to the challenge phase. It's so important that we walk patients through the challenges so that they're understanding of when they're having symptoms, what that means, and how to kind of evaluate that and move forward confidently without a lot of fear of food. So during the challenges, you're going to challenge different foods in each FODMAP group. That includes like fructose, mannitol, sorbitol, lactose, GOS, and fructan. So you'll challenge foods that are isolated in those groups to determine which of those groups are actually triggering symptoms for that individual. Each individual with IBS is going to have different triggers, so it's important to identify what they might be for that individual. After the challenge phase, that takes a couple of months. It can take a while because there's a lot that you're going to go through together. Then you want to move into what we call individualization, which is simply developing a sustainable plan for that patient. So that's where you start bringing foods back into the diet because they've been eliminating these foods for a really long time. So bring those foods back, start incorporating them in a way that's going to feel good for the patient, depending on their triggers. And then start working on ways to impact the gut microbiome. So we know that if we can improve the gut microbiome, then those symptoms are going to subside. We're going to handle stress better, and the tolerance of certain FODMAPs is going to increase and get better. So you want to bring in things like fermented foods. Make sure there's plenty of fiber in the diet. We're still managing stress. We're getting outside. We're doing all of the different behaviors we know can influence the gut microbiome in a positive way. To wrap it all up, don't go straight to the low FODMAP diet with your patient with IBS. Make sure you're screening, make sure you're going to the basics, and then when you start the low FODMAP diet, make sure you fit in plenty of follow-up so that you can get the right care for that patient and give them the support they need so they can see success and management of their symptoms.